Thank
Could
you,
the
sir.
committee hear from Ellen Lennox Smith and her husband Stewart? Would you like your votes recorded, Representative Price? So ordered.
Hi, good evening. My name is Ellen Lennox Smith. I'm a resident in the town of North Scituate. I'm a board member of RIPAC, also a patient and a caregiver, and I take that position as caregiver very seriously for a number of years, and I have not turned into a drug dealer. I'd like to go on record. We'd like to go on record that we support H5865 concerning the increase of compassion centers. And I have 4 simple reasons that I'd like you to consider in this bill. Number 1, the increase of centers would mean a better chance of competition to help bring the price down for us. Right now, the prices are high. If we can increase the number of compassion centers, there's a better chance that the competition will bring that price down. Second, we are supposed to be a medically compassionate program, so offering sites that would be closer to people's homes would be a very wise thing to do. I'm not able to drive. I haven't driven in about 8 years now. If I didn't have my husband to drive me, getting to a center would be a serious problem for me. Third, there is a concern in the medical community today that if we do turn to recreational, what would happen if a person for recreational use came into the center to purchase marijuana, and I then come in looking for my specific strain, but they were possibly able to sell that strain for more money to a recreational user than for me as a medical user. So there is concern about having medication. It's very specific what is appropriate and compatible to your body. So we need that variety available and remaining available in the compassionate centers for patients. And the last point I want to bring up is that although there is a delivery system that's working on, it has not been totally activated yet, there is still a huge advantage to having a compassion center nearer to your home so you can get educated in person and actually visually see the choices that you have available to you for your health. I hope you will seriously consider this bill that would increase compassion centers, and I thank you for your time.
Thank you, Ellen. Any questions? Stewart?
Thank you very much for this opportunity. The last gentleman said he was going to donate some money. If I go over a minute, I will donate 50 cents to his organization. My name is Stewart Smith. Let me qualify this by saying that the police officer that was here mentioned that he couldn't always get access to caregivers. I was not aware of that. I was under the assumption, before I make these comments, that they did have regular access. They didn't have that problem with access. My name is Stewart Smith. I'm the Vice President of RIPAC. I was a former caregiver in the state, and my wife is a current patient and caregiver. I would like to express my concerns for H5103, which states, notwithstanding any confidentiality provisions to the contrary, the names and addresses for persons or entity, including state licensed or state registered caregivers in particular, or cultivators who grow marijuana pursuant to the provisions of this chapter for public sale or use shall be public information, subject to release by the Department of Health. RIPAC has concerns. Medical marijuana caregivers do not sell to the public. Locations of cultivator license are already public information, I thought. You are setting up all caregivers to get robbed, making this information about our public location public. Why would you want to put us in harm's way? What is the point of this bill? And if someone is concerned with their neighbor's grow, I thought they can already easily call the police to have them determine if the grow is legal or not. We were promised confidentiality under the Medical Marijuana Act. Please realize this would be a very harmful addition to our caregivers. My wife takes that position very seriously and keeps the patients in our grow private. These patients have chosen to deal with caregivers so they can maintain their privacy, know they will be able to keep their costs down, and be assured to obtain medicine that is grown specifically for their medical needs. Please don't put us in any danger. Thank you very much.
Thank you, Stewart. Representative Corvese.
As you know, 2 of the major points in that presentation, as you know, was not correct. That had, that's not anything that you would know, okay, because you were under a different assumption, as I was. So I do thank you for your testimony. No one is looking to put anyone legitimately in harm's way, and no one certainly would never break HIPAA as far as someone growing for themselves and using for themselves. That would be inappropriate. However, there are situations which, again, my constituent will explain one where the neighborhood was at risk and the information could not be gotten in any way. So I thank you.
Thank you.